First of all, what proportion is immune once they get infected? There's evidence that it's not 100%. And then how long it takes to build up that immunity, how long that immunity lasts. All of those questions could be answered by serologic testing. There's many benefits, different kinds of benefits compared to the current testing for active infection, and that includes information on whether someone has ever been infected, even if they never had symptoms. A better picture of the burden of disease and the proportion of infections that didn't have symptoms, so we know, okay, it's clear when somebody has symptoms or even passes away and we tested them that they had COVID-19, but there's a proportion of people out there that we know that don't have any symptoms, could potentially spread disease. How big is that iceberg right there? Immunity is not necessarily just yes or no. Levels of antibodies are not exactly correlated with immunity. So if you have low levels of antibodies, that might not necessarily mean that you're immune. So what level of antibody do you need to be immune, and how long that lasts is important. Certainly, one of the benefits in some countries being explored is for high priority groups like healthcare workers. Can they work safely? So if we had the ability to test healthcare workers using a good test and had a good idea of what antibody level confers immunity, we could identify healthcare workers that could work safely because they have that immunity. But it's not just as simple as like a pregnancy test kind of test. But we have learned a lot about the proportion of people that pass away, unfortunately, by age group, for example. Older ages get it, younger age groups seem to get it, but it's a more mild illness. We're learning more and more about the way that the virus interacts with humans on a daily basis, but there are still important gaps. And just as a last point, the serologic testing will help with a lot of our understanding of, looking at the population as a whole, how has this coronavirus impacted us.